So the
Okay.
important thing to remember about dementia, the symptoms, forgetfulness, the not thinking clearly, the decision making, there are times when those dementia symptoms are reversible and they are treatable, right? So there are vitamin deficiencies, there are thyroid issues, there are metabolic diseases. You could have had surgery and had a major dose of anesthetic. And so for weeks, if anyone out there has ever had anesthetic, you have this brain fog. You just feel so weird. You can't,
Yeah.
you just can't function fully quite, right away. So you could have the post anesthetic brain fog. And there were just a litany of other things: sleep apnea, hearing loss, visual issues that all maybe can be fixed or treated or at least made better to increase your clearer cognitions. So that's the other thing. Get to your doctor and say, listen, this is what I'm doing, and
Yeah.
this is new to me. I don't, and then they can rule everything out. So if all the other stuff has been ruled out, right, then they can start with a more definitive diagnosis, which again are some of the cognitive tests. There are blood tests. You guys, the tests they're not great. They're not inexpensive. Some of them are painful. There's a lumbar puncture, otherwise known as a spinal tap. You can get PET scans, MRIs, CAT scans, all kinds of other imaging. There are biomarkers. So not everyone can afford all of these things. Not everyone has the insurance that will cover that. So I think probably a lot of doctors can at least put all of the different pieces together and say,
Mhm.
Amy, in my best medical judgment, based on these tests, I do think that you have A, B, or C: frontotemporal, Parkinson's dementia, vascular dementia, based on your sleep apnea and the fact that you had open heart surgery and the fact that you had a little TIA a year ago. So you get that diagnosis, and this is, what I hope that families can do is that they start putting, what I tell them is putting your team together, right? And it can be a lot of, different things. So first of all, I do think understanding your diagnosis is critical. So what in the world does this FTD mean, right? Bruce Willis's wife on the Diane Sawyer program said that her doctor gave her a pamphlet. Yeah, pamphlet. Yeah, and basically said, "Call me with questions, or I'll see you in 6 months." And she just, you know, unfortunately, again, there are a lot of doctors that are becoming more comfortable, but there are also doctors that are not. So sometimes, unfortunately, it's left up to us to really get that information.